disorder and also different statuses of personality. Unfortunately, the plan according which I need to go through the topics was messed up. That's why sometimes there is a mix of different subtopics in different videos. I'll look through all the videos I have so far and maybe make adjustments in the description so that people will have it easier to find what they want to hear about. Okay, so now, what is autism? Autism is not an actual disease, rather it is a certain neurological wiring of the nervous system of the person, which makes them function a bit differently than the average person. But it doesn't always mean that the person is somehow defective, or for example that the person will deteriorate very soon, or that for example they are worse than other people. Not at all. But I want you not to be too optimistic either, and throughout this lesson you'll know why, because it is rarely that certain deviation from the average midline will give you benefits. It is important to seek ones if you have a certain condition, but do not think that all people with autism are geniuses or something like this. So I'll be talking about it, about this as well. So usually this disorder can be seen even before the age of 3. This condition, and there may be a varying degree, and that's why these disorders are also called autism spectrum disorders, because there is a spectrum by which the person may experience difficulties in social life. Okay. So there is no single cause of autism. It is a combination of different factors, and some of them play a role while the woman is pregnant, for example, and some of them are hereditary, some of them are social. And this applies to the various degrees in which autism may manifest. But always, as I used to say, there is a combination of exogenous factors and endogenous factors. Okay, what else I need to tell you? Yes, so once again, there is a certain risk of you having a child with autism, but no direct, clear reason. For example, if you eat too many carrots, you have an autistic child. No, it isn't like this at all. Okay. Yes, sometimes some professionals believe that autistic disorders may be caused by the allergies to certain fungi, because they noticed the improvement of the child's social skills when there was an improvement in diet. But I would say that actually, if you eat healthier and more frequently, as I mentioned before, in a disciplined way, it will benefit you, whether you have autism or not. So I wouldn't say directly that there is an improvement here, the connection between diet and autism per se. But there was the connection that some anti-fungi meds can be helpful in the social skills. But once again, this is most probably not the direct cause, but the mechanism of metabolism which can play a role but not be decisive in this condition. Also, some parents believe that autism can be caused by immunization, such as childhood immunization from measles, mumps, rubella. And there is a very big panic around this, especially around anti-vaxxers, who claim that the children will become handicapped after getting vaccinated. For such people, there are different posters in the cabinet of vaccination which read, for example, that how do you explain to your son that he is infertile because he was infected with measles when he was little, and with mumps. How do you explain to your daughter that she has a papillomavirus cancer spreading around her body because she wasn't vaccinated, etc., etc., in the symptom? So as you can see, actually, vaccines do not cause autism. It is impossible to cause autism through vaccination. It is something which needs to have a certain predisposition inside, a certain wiring of the nervous system. It's not something you can learn. So, and it is not the result of inflammation or something like this. So, vaccines do not cause autism. But anti-vaxxers and their kids, they are at greater risk for overall all the conditions which can be wrong with their body, except autism. So I wouldn't recommend you to stop getting vaccinated if you are scared of autism. Not to mention that autism isn't the scary thing, actually. It may be challenging, but it is not something inherently dangerous or shameful or stuff like this. So you'll see throughout this lesson, I hope. So how can we suspect the child that maybe the child has autism? So the early signs may be apparent in infancy, from 18 to 24 months, and before 6 years old. So here is that. The most obvious ones tend to emerge between 2 and 3 years of age. Of course, these red flags do not mean that the child has autism, but you may suspect that something is wrong. Okay. Also, individuals with these symptoms, if they are diagnosed with ADD, they must show the symptoms in the early childhood, even if those symptoms were not recognized later. And this makes it very hard, because unfortunately in our society, some people who are hysteroids in their traits may try to imitate autistic spectrum disorders, namely lighter cases, in order to get attention, because they think that this is something fun and funny to have. This is romanticized a lot. And unfortunately, they manifest the most quirky and strange behaviors, but none of the symptoms which actually cause problems for the autistic person. And once again, this makes the work of the clinicians much harder. And that is why you need always to collect objective analysis from your patients, because your patients will tell you all kinds of stuff, but you need to judge also the data you get from people who have seen them when those patients were not aware of themselves, so parents, brothers, sisters, close friends. Because the person may confabulate stuff from their memory, and this makes it harder to understand what's happening to the person. Okay, so what are the early signs? The child will not have big smiles or warm, joyful expressions by 6 months or thereafter, as a reaction to the social interaction. So they will not react to their mother, for example. They will not have back and forth sharing of sounds, smiles, and other facial expressions by 9 months or thereafter. So as you will see, most of these symptoms are pertaining to the communicative function of emotions and speech, and also gestures. So the main problem of people with autism lies in the spectrum of communication, and this differs from the autistic traits of people with schizophrenia, for example, because people with schizophrenia mostly suffer from the problems with their thinking, and very particular thinking symptoms, which I have discussed in the previous lessons. So the person with autism spectrum disorder mostly suffers in the social interactions. You'll see in a minute. Also, there will be no babbling by 12 months, so there is a delay of speech in the person. There is a problem with the interjecting skills from other people. There is a problem with identifying with other people with autism. So there are no two-word meaningful phrases without imitating or repeating by 24 months. So as you can see, there may be echolalia, for example, in the person, but in the child, but the child will be just parroting. They are not conscious about what they say, even if their age is already the age when the child should understand what they're saying. Also, you may see any loss of speech or babbling or social skills at any age. And this is also very red flag. Also, the child doesn't make an eye contact, especially even if they're being interacted with. They don't smile when smiled at. Also, they do not respond to their name or to the sound of a familiar voice. Once again, in the description, I will find those cool archive videos of children with autism, and you'll see how it looks in practice in these little children. Also, they do not follow objects visually. They do not point or wave goodbye or other gestures to communicate. So once again, communication function is cut off here, because people with autism are mostly directed inward in their energy. They experience problems with interaction with living beings, and I will tell you this in a moment. They do not follow the gesture when you point things out as well. They don't make noises to get the attention. So the child with autism, for example, they may try to resolve their problems on their own, and they won't refer for the adult to help. Or if they actually try to refer to the adult for help, for example, they want to get a toy out of their reach, they won't come and ask, for example, give me that toy. They will take the hand of the person who can reach the toy, and they will try to knock this toy out with this hand. So they're operating another person as if it was an object, as if it is an instrument. Children with autism will not initiate or respond to cuddling when they are little. They do not imitate the movements and facial expressions. So with speech, they may be parroting, but not with the movements. They do not reach out to be picked up. They do not play with other people and do not share their interest and enjoyment. So they prefer solitary games, and they prefer engaging with objects rather than with people. And you'll see this once again, it is very pronounced. It is easier to engage with objects because they do not require this emotional connection, they do not require this communication, active communication going on. So, and they also play with objects in a very unusual way. So, for example, they may pick up stones and just roll them, not play pretend with them, for example, and just roll them. They do not play pretend in games with dolls, for example. They may just touch the dolls, like turn them around, put stuff on them, put stuff off them, try to dismantle the doll, but they will not play pretend with other children. Also, they do not ask for help or make other basic requests, so that's what I mentioned. Also, in the presentation, there is a picture of a child with toys placed in a row around their bed. So the thing is that apart from the communicative problems, children with autism also have problems with adjusting to novelty. They're extremely possessive of their routines and extremely loyal to their routines. And this child in the picture, he has a ritual before going to bed. He places all his toys in a row. And since these children, they are so used to their routine. It is not on the level of an average person. For example, you may say, oh well, but for example, I like to brush my teeth every morning. That's my ritual. And I also feel distressed when it is disrupted, of course. No, in children with autism, disrupting their usual routine will result in fits of anger, in fits of hysteria. They will feel extremely uncomfortable, they will feel lost, they will feel annoyed if something happens with how things should go according to plan. People who are older with autism, for example, they will not tolerate people being late on dates or changing the date of the meeting very suddenly when there is only one day left or something, because it's very stressful. Of course, the older people with autistic traits get, usually they become more adjusted to this and more tolerant to this stress, but they still get annoyed. And The younger they get, of course, they will give you the raw reaction. So in case of little children with autism, disrupting their usual routine results in fits of anger. Okay. So the syndrome of early infantilitism is called Carnage syndrome. This syndrome is most often paired with the serious delay in speech and also with serious diminishment in the intellectual activity. So that's what I was talking about previously. Do not romanticize autism. Unfortunately, 3/4 of children with autism will have certain diminishment of their IQ. Not all of them. Some children with autism will display excellent skills in certain sphere, and this is called savant syndrome. You may have seen this series called The Good Doctor, something like this. It is about a person with savant syndrome, but that's rare. Most of the times, unfortunately, it is average or below average intellectual ability. So about Carnage syndrome, there are 3 categories, each with 4 components, which we use to diagnose the autistic disorder. So these categories include social interaction, which I have mentioned before, communication, we're talking about communicative skills, and also patterns of behavior. So let's look at them. So about the social interaction, there should be impairment in at least 2 of the signs. So what are those signs? Impairment in the use of non-verbal behaviors, for example, eye contact, facial expression, body posture, and gestures, what I mentioned in the early signs as well. Also, failure to develop age-appropriate peer relationships. So there are no friends, there are no close friends or acquaintances by the age when they usually form. The child is mostly alone. There is a lack of attempts to share pleasure, activities, interests, or achievements with other people. So, for example, a little child, while drawing, an average little child, would probably show their drawing to their parents, to their friends, or like show a new toy they got. The child with autism will be observed by this activity, and they will not feel the need to share afterwards, because they are perfectly fine with having it to themselves. So they just do not feel like sharing about this passion with others without any dire need. Also, there is an ability to respond to social situations or other people's emotions with empathy or concerned attitude. This is a very difficult question, because people with autism, obviously, что? Okay, that's a child without autism bothering me right now. Okay, people with autism obviously have feelings and sensations, and they actually can sympathize other people, they can empathize other people, but the problem arises that the expression of the emotions is diminished once again, because expressions, I have mentioned it before, expressions are used in order to communicate, and if you do not need to communicate your own emotions to other people, this means that you won't show them if you are concerned about them. So on the surface, their relationship with other people may seem very formal, like even if they actually are compassionate towards you, actually, but they just cannot show it appropriately. And they do not read facial expressions. They may have problems with intuitive understanding of what other people mean, how they feel, unless these people tell the autistic person right away, directly, what they feel. And this creates all sorts of misunderstandings and difficulties in social life, because a lot of us have certain understanding how social cues work, and it is considered a general knowledge. But for people with autism, this general knowledge is not general at all. They do not get it, and certain things need to be explained. I have seen a set of instructions for the autistic child, how to learn to say sorry. So when you say sorry, how do you do this so that the person will actually believe you, that you feel sorrow for what you have done? if your facial expression doesn't show it. So how do you do it correctly? And that is why, for example, also children with autism may have problems understanding metaphors, understanding irony, because there is an underlying undertone of meaning, which needs to be general knowledge, but it is not. Okay. There is even a certain array of tests used to see if the person has autistic spectrum peculiarities of thinking, but not those with, like people with schizophrenia, but specifically autistic type of thinking, when there is problem with these meanings. And also, I have mentioned before that autistic traits include certain egocentrism. So the person with autism has a certain view on how things work, and therefore they may share these beliefs on others, and that's another source for misunderstandings when they try to communicate. And one of those tests used to check if the person has autism includes a test of perceptions. So it is a story about the girl who went to school to buy cakes, and there are multiple questions about what was happening from the perspective of different characters in this story, what they know about this girl and what they do not know. Because we, as the narrator and the patient who is being tested, as the examinee, know everything what is happening in the story, but the characters inside of it may not know what is happening to another character when this character is out of sight. And so we check if the person with autism understands that their knowledge and the knowledge of this character differs. So that's why it is important to use such tests. Okay. When we are talking about communication, there should be at least one of the following. So communication is even more important. And so there may be a lack of or delay in development of spoken language without attempts to communicate through alternative means such as gestures or mimics. So once again, communication very impaired. Also, in individuals who do speak, there is severe impairment in the ability to initiate or sustain a conversation with others. The difficulty with initiation may look like that the person doesn't really know when to butt in the conversation. For example, a group of people is talking and the person with autism wants to join, but at which point? How to approach this? How to say hi? If I don't know those people, how to interact with them? What to talk about first? What is small talk? I don't understand small talk. So such things. And sustaining a conversation may be difficult because the person with autism may get carried away by the topics they're talking about, and they will not notice your mimical expression showing if you are interested in what they say. In most severe cases, the person may talk to you when you are turned away, because unless you say directly that they don't want to talk, they don't read your gesture of being turned away or changing the subject or something like this. I have been in multiple situations with this when I was just bragging around about the topic, which I really liked, and the person would change the topic and I would be okay, answer the questions about another topic, and then return to the previous one and continue from the same point. And the person would be very annoyed, but I wouldn't understand this until I am told this to my face, that I'm annoying and I need to stop and to change the subject because everything just changes a lot. So it is very hard to change overall. It is very hard because you're stuck in your patterns. So here is this. Also, there is repetitive and stereotyped use of language, use of words in the usual idiosyncratic ways. So what is meant by this? The structure of the speech is strange. The sentences may be robotic. There may be a lot of repetitions. If you have noticed, my speech is not modulated by the intonation, but mostly by the volume of my voice. Because once again, it is hard to put my emotion in my voice. So I'm not using the tone, I'm not using the intonation, I'm mostly using the volume. Another sign and interesting trait is that once again, people with autism may have problems modulating their voice, and therefore, for example, they may be shouting in situations when their partner can hear them directly, and you shouldn't shout, but they are shouting, and be whispering in other places. Okay. Ага. Сейчас. 1 minute. Уже переезжать или еще нет? Так это, мне переезжать, я могу переехать. Нет? Ага. Okay, I'm occupying the bathroom, and people need to use it in a minute. Okay, so what else? There will be failure to show imaginative play, so I have mentioned it already. Also, the thing that they do not play pretend, so they do not assume roles, doesn't mean that this patient, these people with autism are unable to imagine things. Actually, their imagination is very rich and is very, very, I would say, vivid. And I had this not very pleasant, but also very useful experience when I was working with a girl with Asparagus Syndrome, and that is also an autistic spectrum disorder, which we'll be talking about later. And I was using hypnosis, a hypnotic technique with her. So because she had a problem with having public speech, and I needed to work with this fear. So I try to use the technique when you imagine that something horrible is happening to your surroundings with your eyes closed, and then you open your eyes and you see that everything is fine, and that helps to be distinctive about your fears in your head and reality. And so I chose an object which would be an anchor in this trance-like state, so the object which will not be changed. So that was the Rubik's Cube, which was around her. And I asked her to close the eyes and imagine that her room is bombarded with meteorites. She described me how her room looks with this bombarding, and then I asked her to open the eyes and to describe her room once more. And when she did this, I understood that she is still describing her room as if it was in ruins. So she was still under trance, even with the open eyes, and she was induced and she was listening, and I was very scared because we were working online, and I was very dumb actually to start this work like this. I underestimated the ability to be suggestible. But we had the Rubik's Cube, so I asked her about the Rubik's Cube, and it was fine. So then I used another hypnotic pattern with the Rubik's Cube. It is called X and X and X and X. So at first 2 X's, you give 2 general truths to the persons, and the third one will be a suggestion. So the suggestion needed to get her out of the trance, and the first 2 needed her to be susceptible to the suggestion. So I used this formula. I told her that right now you are hearing my voice, and right now you are sitting where you are sitting, and you are also breathing, and like this you start seeing your room once again as it was before the trance. And everything stopped, and she described the room as it was in reality, and I was very relieved, and decided not to practice this ever again, like this, to be very careful. Probably it wouldn't actually do anything bad to her, because if you are in trance you just fall asleep, and when you wake up everything is fine. But I didn't want to leave her like this, because I don't know if I told this, but when I had my first episode of psychosis, it started from the suggestion which I gave to myself. So it is best to be very careful with those things. Okay. And the third category is behavior. So the behavior is restricted, repetitive, and stereotype pattern. Also stereotyped activities, interests, and they are demonstrated by at least one of the following. So as you can see, behavior is also very restricted. So unusual and overly absorbing preoccupation with one or more interests or activities. So when I start to classify people, and I love classifications, I cannot be interrupted. I will get really annoyed if I get interrupted, and it is at the level of physical distress when you need to stop what you are doing and do something else. So it is almost impossible. And I have fallen into this trap multiple times. So I was told by my psychotherapist to stop classifying people because it was distracting me from other activities in life. And one day when I was at work, I thought about classifications. And at the same moment, I understood that I cannot stop thinking about them. I need to draw a diagram. I need to sit down and do this, but I was at work. I needed to do something else, but I wanted to do this, and I was stuck. And I felt physically how it was hard to pull my mind away from these thoughts. So that's how strong it is. Also, activities of people with autism may be very bizarre. So, for example, they may be preoccupied with an object, but not with the whole object, but with its part. For example, moving tires on a toy car, or for example, observing and touching the nose of the kettle, such stuff. So, if you have seen those cool collectors who collect, for example, well, post stamps are usually a normal thing to collect, but for example, I would say the caps of bottles or such stuff. So you have thousands and thousands of these objects around. Okay. Also, there is a need for rigid adherence to specific routines or rituals in daily life. So once again, if you stand up at certain time, you stand up at certain time, and if it is interrupted, your whole day is ruined. I have a very particular way to organize papers on my desk, and I become furious when it is interrupted. So when I take the papers from the main cabinet and then I place them on my desk, all the papers from the top shelf should be placed horizontally. All the papers from the middle shelves should be placed vertically. And all the papers on the last shelf should be placed diagonally. And like this, I know on which shelf these papers lie. And also, I usually put them on the right side on the left side of my desk, on the right side of my desk, or in the center. Once again, according to their position on the shelves. Other people who see this, they just jumble everything in one big pile, and this is horrible because then I don't know where they were placed. And when other people do not understand why I do this like this, they don't understand why I sort things, and they start asking they start telling me that it wasn't chaos, it was disorganized. No, it was organized, but according to my rules. Yes, I'm getting very emotional here, so that's the level of distress you feel when your routine gets disrupted. And that is cool when, for example, you have a work which is connected to the adherence to certain rules and structures and routines. But if you live a dynamic life, you need to be adaptive, you need to be flexible, and it becomes a problem for these people. Also, there may be stereotyped and repetitive motor behaviors with parts of the body, such as fingers or hands, or the whole body. So different like tics, tremors, such things. They may have like movements of the fingers like this, so I do such stuff sometimes. Also, there is a certain posture, so some people with autism may have like this called, well, I'm bringing them very high for you to see, but this is called like raptor arms, when you are having your arm bent like this. And this is the rest pole posture. So it is comfortable for the person to be like this. And I was repeatedly scolded in my childhood for this posture, and I didn't even understand what was wrong with it until I actually recognized that it was the symptom of autism. So here's that. But I do not have, I would say, like a classical autistic spectrum disorder. I have schizotypal personality disorder, so it has some traits of autism, but not the full extent, not the full degree. Also, preoccupation with parts of objects is also transitioning onto the parts of the body. So, for example, the child may be playing with their hand like this and like with their fingers, but as if it is not a part of their body, as if it is detached. So here is that. Okay, I have already talked about the intellectual ability. Also, about 25% of individuals with autism spectrum disorder are non-verbal but can learn to communicate by other means. So it is, once again, it is not the curse, it is not the end of the world. If you have a child with autism, everything can be made to your benefit and to the advantage of your child if you choose an appropriate education and appropriate way of upbringing. So any child needs attention from their parents and understanding, and that's what you can give them regardless of what is happening to them. Okay, so in the infantilitism, the behavior disorder is one of the main problems. Okay, so about the fits, so the fits are thrown not only when there is a disruption of routine, but also when there is sensory overload. So some children with autism may be overly sensitive to stuff. So for example, they may not tolerate loud noises, very big flashes of light, for example, and therefore children with autism may have muffs on their ears in order to feel comfortable being in social situations, for example. Also, for example, I do not like certain textures of the food, therefore I avoid eating mixes. And it may be very funny, but the only mixture I am able to tolerate is the burger from KFC. Not the very healthy food, but the one I feel comfortable eating all together and not separated. Also, for example, I'm very sensitive to temperature, so I only warm up my food for 10 seconds and that's all, because everything above 10 seconds with my microwave, it is too hot for me, so I'm not able even to eat properly. So here is that. Because of this, because of being overly sensitive, the child with autism may experience meltdown, and this may look like a hysterical fit, but it is actually physically painful for them to have so much noises around them, to have so much stimulation around them. Also, they may not like the labels on their clothes, for example, and if the clothing is not comfortable for them, they will not wear it. They will oppress any attempts to give them a certain to give them certain clothes, etc. So here is that. Okay, in case of Asparagus syndrome, the speech is poorly developed. So I told you, so a lot of these children are mute, unfortunately. Okay, and if the speech develops, it may not be used for the personal contact. So once again, echolalia present here. The children may also repeat phrases they hear from movies, they hear from adult people without context, and they will not understand how to use those phrases. Okay, what else? Yeah, so the forms of cognition are usually abstract for these children, but they are formed with primitive tactile and taste and olfactory analysis. And because of no reaction to the sound of the voice of their parents, many children with infantile autism need to be checked for deafness, because that's the first thing their parents think when they see such reactions. Okay. Also, a lot of time the children with autism may have problems with their motor sphere, so they may be very clumsy. So that's another thing you need to take into account. But on the contrast, there may be relative strength in other spheres. Okay, what else? The children with autism may be preoccupied with the details, but they fail to see the whole picture of certain things. Okay, what else I need to say to you? Okay, so one syndrome, I have talked about this. Yeah, also there may be disturbances in patterns of eating and sleeping. So the children may need to eat and sleep in an appropriate time of the day. So for example, they sleep throughout the day and throughout they're very active. And this may be very difficult for parents because parents need to monitor what is happening with their child. Okay. Talked about this. Yes, I have talked about this as well. I'm just checking the plan if I'm not forgetting anything. Yeah, I have told you that human sarcasm is usually not understood. Okay, so Asperger's syndrome. Asperger's syndrome is majorly different from CANAS because there is no speech delay in Asperger's, and frequently they have good language skill but use language in different way. Also, they are very clumsy, children with Asperger's. Most of these children do not have a significant cognitive delay, which is actually not not the direct sign of autism in children, even in without autism, if we're talking about those, but a consequence because of the general problem with communication with other people. Okay. Okay. So, what are the criteria for Asperger's Asperger's syndrome? It is a marked impairment in this of the form, marked impairment in the use of multiple nonverbal behaviors. First, failure to develop peer relationships appropriate for their developmental level, lack of spontaneous seeking to share enjoyment, lack of social and emotional reciprocity, and also restricted or repetitive patterns of behavior, at least one of the following: delay or total lack of development of spoken language, not accompanied by the attempt to compensate through alternative modes of communication. Okay, what is that? I see. It is about the spoken language. When we are so I previously told you that in Asperger's syndrome there is a difference from CANAS syndrome, that there is no problem with language. So the thing is that there is a certain delay in the spoken language, so this language which is used for communication in both of those cases. But in the infantile autism, in the CANAS syndrome, there is overall problem with language, so most of them will be mute. Well, in the Asperger's disorder, it is much less frequent, so that's the difference. I'm becoming very tired right now. It's very late and I started to forget things. Okay, also, in individuals with adequate speech, marked impairment in the ability to initiate a conversation is present. Also, stereotyped and repetitive usage of language and lack of very spontaneous make-believe play. Okay, so it is the same. Also, disturbance causes clinically significant impairment in social, occupational, or other important areas of functioning, and there is no clinically significant general delay in language. So there are single words used by the age of 2 years, unlike in infantile autism. Communicative phrases used by the age of 3 years. So that's fine. And I have heard that some parents reported even their child to start speaking very early, actually. So there is no clinically significant delay in cognitive development, and there are no criteria met for other disorder, of course. So there is a lot of different screening tools for the autism diagnosis. And how do we differentiate from other disorders? So when we're talking about mental retardation, usually in mental retardation there is an even underdevelopment in all psychic spheres. So the child with autism usually has uneven development. So in some areas, for example, social functioning, like emotional response, they will be under operative, under functional. But for example, in mathematics, in logical things, the child will be excelling. So their development is uneven. In mental retardation, well, you have mental retardation, you are diminished by all the scales. Also, children with mental retardation but with no autism regard other people as living beings and not objects. Children with autism will see you as an object to a certain extent, try to interact with you as an object. So that is also a difference. Also, children with only a language disorder will have their speech, but they will have no problems with social communication and interaction. In schizophrenia, there will be specific disorders of thoughts and disturbances of emotions, and as well as productive symptoms, so hallucinations and delusions. In the child with autism, hallucinations and delusions are not evident. So if they start to progress, usually it is at the very least an accompanied psychosis, or at the very most a childhood schizophrenia. And when we are talking about degenerative organic brain disorders, mostly it is a very rare condition. And in this case, the child develops normally, but then suddenly starts losing their skills. And in this case, psychotherapy won't work, adaptation won't work, because it is a progressive impact of the nervous system. So here is that. Okay, I have talked about that. In the presentation, there is also a scheme once again for the schizophrenic symptoms, which I use to explain the difference between schizophrenia and autism, but I already tackled those throughout this talking. So what is the treatment? Treatment is symptomatic. Most of the times we do not treat autism. We try to educate this child and to bring it up to be as functional as possible. We learn social cues. We learn how to recognize context. We learn how to be less impulsive and to tolerate stimulation, to understand how to react to this and to go around these obstacles, for example, using muffs and such. Art therapy is very good, animal therapy is very good. Medication is used in severe cases when there are pronounced behavioral problems. And in this case, mostly we use neuroleptics, mostly of the second generation, so like risperidone, quetiapine, such stuff. And we also try to enhance verbal skills. Different tranquilizers may be used if the child suffers from anxiety. So symptomatically, here medication is not the basis, because it is not considered to be a disease. It is a certain condition which needs to be adapted to the life of the person. Okay, we have talked about medication. We have talked about medications. About medications, once again, sometimes people use secretin and tell that it helps from autism. But once again, if your bowels work properly, if your digestive tract doesn't hurt, you will feel much better, regardless of having autism. Okay, so we have talked about this, about that. Also, different nootropes may be used, which enhance the bloodstream in the brain, vitamins, so different overall things. Okay, what else? Let's have a break for 30 minutes, and then we'll continue. Okay.
Я вас выгоняю. Конечно, конечно, мама.
already this. So let's finish off the topic for today. Okay, another thing I needed to talk about today is Rett syndrome. And so this disorder is a very rare genetic neurodegenerative developmental disorder which almost always affects females. I have seen only one patient with this disorder when I was in practice in the hospice of Kharkiv for children. And so it is characterized by the period of normal development, usually the first 6 months of life, after which the head growth stops and social withdrawal appears, and there is generalized slowing of the development. Generally around the age of 3, this regression slows and leaves severe mental retardation in combination with neurological deficits, including spasticity, seizures, and trouble coordinating their breathing and eating. Children, and during this plateau, usually social engagement becomes better. I have seen, when I was seeing that patient with this syndrome, I was talking to their parents, and the parents told me that this is all due to the vaccine, but obviously you know that vaccines do not cause such disorders. So unfortunately, in early puberty, there will be further deterioration for the child in the motor function, with progressive scoliosis and muscle wasting. These children become wheelchair bound. So what are the criteria for the Rett disorder? Apparently normal prenatal and parental development. Apparently normal psychomotor development through the first 5 months after birth. Normal head circumference at the birth. And onset of all the following after the period of normal development. Acceleration of head growth, loss of previously acquired possible hand skills between ages 5 and 30 months, with subsequent development of stereotyped hand movements, for example, hand wringing or hand washing, such things. And she was constantly doing this. There is loss of social engagement early in the course, though may develop later. Also appearance of poorly coordinated gait or trunk movements, and severely impaired expressive and receptive language, with psychomotor retardation. So here is that. Okay, now about attention deficit and hyperactivity disorder. It is also a very interesting thing. It is mostly neurodevelopmental as well, and I have seen a handful of people who like to imitate this disorder because attention deficit sounds very easy to understand, sounds very common and very relatable, but actually when we are talking about the level of disorder, there is a certain variety of differences between the disorder and the person who tries to imitate the disorder or things that they have in disorder. So let's try to discuss what is different here. So the main symptoms include difficulty staying focused and paying attention, difficulty controlling behavior, and their overactivity. That's, to put it simple. It has three subtypes: predominantly hyperactive impulsive, predominantly ineffective, inattentive, and also combined. What you need to know is that this is a childhood disorder. Most connected with the immaturity of the brain, because most of the children have troubles controlling their impulses, and most of the patients with this disorder, which was diagnosed at the age of 7 years old, this is important, the signs of this disorder should be evident to this age, they become much more adaptable in the later life, and they overcome these symptoms. So rarely there are adults diagnosed with this disorder. I would say that most of the times, if you're an adult, you're able to be adaptable with these symptoms. Okay, so the causes are numerous: genetic factor, environment, brain damage, food additives, psychosocial factors, different stuff. Once again, multimodal thing. So what are the ICD-10 criteria for ADHD? Okay, first of all, before we discuss clusters of these symptoms of hyperactivity, impulsivity, and inattentiveness, I need to tell you the most common things is that autistic disorder is no later than the age of 7 years. Once again, gather your objective analysis. Also, it is pervasive, so the criteria for this disorder should be met more than in a single situation. So it should be the same thing at work, the same thing at school, the same thing at home. Because if it is limited to certain context, this means that this context is the source of the change in behavior in the child. So it is not ADHD, it is not neurodevelopmental disorder. And also the symptoms in the impulsivity and hyperactivity clusters should cause clinically significant distress or impairment in functioning. Not on the level, oh, you know, I cannot make my homework because like I have this. No, like serious impairment. And when I will be discussing the concrete criteria for this, you will know what I mean. Okay, so when we are talking about inattention, at least 6 symptoms of attention deficit should have persisted for at least 6 months to a degree which is maladaptive and inconsistent to the developmental level of a child. So, what are those symptoms? For example, often fails to give close attention to details or makes careless errors in schoolwork, work, or other activities. And we are not talking about little negative things. We are talking about serious problems. For example, the person makes a mistake in report, and because of this mistake, for example, somebody gets hurt, something like this. So obviously there is no secondary benefit here to the person making this mistake. And the person making the mistake, namely the one with ADHD, knows which consequences come from this mistake, but it is out of their control. When I was seeing this patient who was trying to imitate ADHD, he was a very interesting patient. He was a psychologist. He tried to prove to me that you cannot measure attention, which I was very surprised to hear this from the psychologist who, more than me, should know how to measure attention objectively. And I was testing him both objectively and also interviewing him and also viewing him with the commission of doctors and psychologists. And all of these tests prove that he has no attention deficit. So he tried to tell me that him making little typos in his text is enough to be a criteria for ADHD, which is obviously not it. Also, another symptom often fails to sustain attention in tasks or play activities. And this is important in play activities as well, because this guy, once again, he was making it so as if he wasn't hearing you during the conversation because of his ADHD. But first of all, there was a delay between his reaction and what you were saying, so it was artificial. It was not a genuine response that when he tried and asked you to repeat things. He only did not hear things which he didn't want to hear, obviously. And this was not evident when he was playing, when he was relaxed. All those symptoms appeared only when he was monitored, but when he was relaxed, none of those were evident. Not to me, but also to other people. So here is that. Also, often appears not to listen to what is being said to him or her. Once again, it should be genuine. The person seems like this throughout the whole time you are with them, and it doesn't depend on the person they are talking to. Also, often fails to follow through on the instructions or to finish schoolwork, chores or duties, not because of the oppositional behavior or failure to understand instructions. So this should be systematic. This happens all the time, constantly, everywhere in the person. And also is often impaired in organizing tasks and activities to the point that they cannot do this at all. And you see that it is not due to the lack of attempts. It is the function which is impaired here. Often avoids the strongly devised tasks such as homework, which requires sustained mental effort. Well, this is mostly contextual symptoms, so I wouldn't rely on this too much. Also, often loses things necessary for certain tasks and activities, such as school assignments, pencils, books, toys, or tools. And this is important. The person may lose the keys from their apartment. I mean, and will not be able to sleep over, for example, in their own bed. That is the level of ADHD. They may lose their documents over and over again, once again, which is typical for this disorder. That guy never was inspired anymore, as I know. Also, is often easily distracted by external stimuli. And once again, this is systematic, and this doesn't depend on the type of the stimuli. So it is pervasive. The person doesn't choose which stimuli to get distracted with. And it's often forgetful in the course of daily activities. This is a consequence of diffused attention for the person. Okay, so now about hyperactivity. So at least 3 symptoms of hyperactivity should persist for 6 months to a degree which is maladaptive. So often fidgets with hands or feet or squirms on the seat. This includes contexts when you have to be seated for a very long time and you should not leave your seat at any cost. Often leave seat in classroom or in other situations in which remaining seated is expected. So that guy who tried to imitate attention deficit and hyperactivity disorder was able to sit through a 5-hour event, 5-hour long event. Obviously, he had no disorder from this class of symptoms. Also, often runs about or climbs successfully in situations in which it is inappropriate or dangerous. So once again, the key feature is that I'm sorry, I'm just very tired. Is that it is very dangerous to the life of the person. So, for example, the child may run about the street like this and may get under the car, for example. So you see that there is clear loss of control over the behavior. Also, is often unduly noisy and playing or has difficulty in engaging quietly in leisure activities. Also, often exhibits a persistent pattern of excessive motor activity, which is not substantially modified by social context or demands. So once again, it seems as if the child is ignoring the demands, but actually they hear it. But it just appears that they, like bullies, they just run around. Impulsivity. At least one of the following symptoms of impulsivity has persisted for at least 6 months to the degree which is maladaptive and inconsistent. So once again, the level of impulsivity in the ADHD is not just butting in other people's conversations. It is a 4-year-old child which climbs on the water tower, for example, and doesn't know how to get down from it. And doesn't even remember how they got there in the first place. They just didn't have any time to react. They were impulsive. It is the level of a girl who masturbated in the front of the whole class in school because she just felt like it. That level of impulsivity. Okay, so for example, often throws out answers before questions have been completed. This sign. Also, often fails to wait in line, so wait in turns in games or group situations. So once again, queues are just unbearable for such people. Often interrupts or intrudes on others. Often talks excessively about without appropriate response to social constraints. Once again. Also, there is such state in people with ADHD called hyperfocusing, which is another side of the coin of deficit of attention. And in this state, they will get stuck on certain activity without being able to switch to anything else. And once again, when we are talking about the level of a disorder, it should cause direct danger to the life of the person and very big level of maladaptiveness in their life. So what I mean by this, for example, I probably already told this example on the previous lessons, but I'll repeat once again. There was this guy with ADHD who was only getting hyper-focused from doing a certain activity, doing sports. And so one day he went to the basement to do sports, and he was doing sports for 3 days straight without having any rest, without sleeping, without going to the toilet, without eating, without drinking. And his parents basically fetched him out of the basement half alive. He was rushed to the intensive care. That is how dangerous the hyperfocus and the ADHD can get. So here is that. So how do we treat such disorders? Well, in the ADHD, most of the times, it is effective to use psychostimulants. And it is another diagnostical criteria. In the ADHD, the psychostimulants give a relaxation effect, a tranquilizing effect, a sedative effect on the patient, and not stimulating. While on the normal people, it is stimulating. Also, well, on the average person. And this is another very important diagnostical thing. No clear secondary benefit and no control over the symptoms. That guy who tried to imitate ADHD not only had the control of the symptoms when he would show them and how, and he literally claimed that he has all the symptoms from the criteria, and when we asked him about these criteria, he didn't remember a single symptom. You know, like you may not know the criteria, official criteria, but if something is bugging you constantly, you will be able to name it. So that's first thing. And also, he specifically referred to me in order for me to prescribe him medication. That was his request from the very start. Medication from ADHD. And psychostimulants, as you know, they include amphetamines. They are basically drugs which cause addiction. So of course, I was very suspicious at his it froze for a minute. He clearly just wanted the pills. It was showing the signs of dependent behavior. So he was actually a drug addict and not the person with ADHD. Not to mention that in Ukraine, specifically where I'm working right now, it is prohibited from giving our patients amphetamine drugs as medication. So in Ukraine, you treat ADHD with no drops and relaxation techniques. And these patients usually are very receptive towards hypnotic techniques, towards relaxation techniques. So, and especially discipline and organizing stuff. If you think that if you have ADHD and you get your pill and you will be well, that's less than half of the work. No, you need to discipline yourself. You need to take your time to try to organize things, to break complex tasks down to little tasks in order to get the best result possible. Also about the differentiation, once again, that simulant was given the task to concentrate on one object without thinking about anything else for 7 minutes. For an average person without any ADHD, this is a nearly impossible task without multiple attempts, because it is just plain boring to do this. Well, that guy was able to do this for 40 minutes, but that wasn't hyperfocus. He was trying to make himself seem cool that he could do this, but clearly, obviously, he didn't have ADHD. He was able to do this. Okay. To work with anxiety and depression, which often goes hand in hand with this disorder, we usually use antidepressants and at times also sometimes neuroleptics and tranquilizers. Once again, we will be talking about those groups of medications on the last lesson, the next one. So here is this. What else? Okay, so psychotherapy is also important, both individually and group psychotherapy and family psychotherapy. There is also behavior modification therapy, basically behaviorism, which enhances the positive response when the child does what they need to do. Also, electroencephalography biofeedback is used in order to teach the person with ADHD which states identify with the desirable behavior. Okay. Also, there is such disorder called Electrolyte Syndrome. So it begins in childhood between the ages of 2 and 10 years, has a hereditary nature, and boys are more likely to have it. It is manifested by chronic tics, and these tics may occur at the beginning of blinking or jerking the head, grimacing. As a teenager, there may be joint voice and complex motor tics, changing their location and having aggressive components, sexual component. Sometimes coprolalia, which is one of the most famous symptoms of Tourette syndrome. And it is characterized by the combination of impulsiveness, obsessiveness, and decreased ability to concentrate. Most of the times it is treated with antidepressants and minimal dosages of neuroleptics, because neuroleptics have myorelaxant and anti-epileptic effect. They diminish the impulses in the brain. Okay, we have a handful of slides left. I hope that I will be able to finish much quicker. So, personality. Just a reminder, personality includes our own experience in life, our temperament, our traits of character as well. And traits of character, our character mostly manifests itself by the sets of attitudes towards ourselves, other people, the world around us, the objects, and our work. And unfortunately, when something goes wrong in the formation of personality, it may develop as a psychopathy, psychopathic type of personality. It is a personality disorder, a way of thinking, feeling, and behaving that deviates from the expectations of the culture and causes distress and problems with functioning and lasts over a long period of time. And this is important. Just on the basis of the person being different from us, we cannot conclude that they have psychopathy, but they need to have a certain impairments in their social functioning. So most of the times in psychopathy there are 4 components which are different from different types for different types of psychopathies. And if you know, for the ICD 11th revision, the individual types of psychopathies were removed, and only these scales are evaluated, like, and the severity of the disorder of personality overall. But there are no names for these groups. For the sake of history, and because in Ukraine we still use ICD-10, we talk about these types, and I would say that these types make it easier to label things and make it harder for stimulants to emulate these things, this diagnosis. But when we are talking about only evaluating scales, it is easier for the specialist to do. Okay. So for the psychopathy, the typical is the triad of Ganushkin-Kabikov, which consists of social disadaptation, stability, and totality. So we can diminish psychopathic traits via psychotherapy, but we cannot get rid of them at all. Psychiatrists only deal with psychopaths when there are pronounced behavioral disorders and when there is a comorbid pathology in the psychic sphere. In all other cases, it is a law problem, and the problem is police, not with the doctors. Okay, so personality disorders can be classified as specific personality disorders, mixed and other personality disorders, also enduring personality changes not attributable to brain damage and disease, and also other disorders of adult personality and behavior, which includes simulating, malingering, and stuff. So, what are the main types of personality disorders? There is antisocial personality disorder, or sociopathy, or as it is also called dissocial personality disorder, also avoidant personality disorder, borderline personality disorder, or emotionally unstable personality disorder, dependent personality disorder, Histrionic personality disorder or demonstrative personality disorder, narcissistic personality disorder, obsessive compulsive personality disorder, paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. I have described schizotypal personality disorder on the previous lesson, so I won't be stopping on it here. So let's talk about other. So emotional unstable personality disorder or borderline personality disorder. The person with this disorder has a definite tendency to act impulsively without consideration of the consequences. Their mood is very capricious and unpredictable, and they may have very wild mood swings, so to the level of depression, but for a very short period of time. There was this patient with borderline personality disorder who told me that she fell into depression for 2 hours because somebody in the conference criticized her pancakes. So they are also very, I would say, sensitive to the critics. There is a ability to outbursts of emotions and incapacity to control the behavioral explosions. But all this is adequate to the stimulus. Also, there is a tendency to quarrel sound behavior and to conflicts with others, especially when impulsive acts are thwarted or censored. So this can be divided into more impulsive type and more to the borderline type. In the borderline type, there is also addition of disturbances in self-image, aims, and internal preferences. They may feel empty inside. They have no distinct understanding of their own personality and their identity. And the personal relationships are often very intense and unstable because they tend to polarize everything. Everything is either very good or very bad, and there is no middle ground at all. And they may be very thankful to you one minute, and the other minute they will be hating you for something. But there is always a stimulus which causes it. Unlike in psychosis, for example, when this stimuli is inborn. Here we are internally born. Here we are talking about two reactions to the others. Also, they have a tendency to self-destructive behavior, including suicide gestures and attempts, and they are mostly demonstrative ones. Okay, I have talked about schizotypal disorder. Now, about paranoid disorder. So, paranoid disorder starts at early teens. Usually, the person is governed by the delusions of being exploited or harmed. They have groundless distrust in friends and partners. They are usually dissatisfied with everything. They refuse to apologize. They underestimate people. They are very suspicious and have a tendency to distort the meaning of neutral messages into the harmful ones, which correspond to their expectations of other people. They have a very stubborn attitude to personal matters, prone to be jealous and usually convinced in being cheated. They have a lot of ideas of reference, love to talk about conspiracy, and maybe explosive. But on the good part, they're usually very good workers, very relentless workers. So I had this patient who was a teenager. I had very limited information about him, but judging on the surface, he clearly has paranoid disorder, and so he was constantly getting into quarrels with other people, with conflicts. He was in the seek for the justice, in the search for the justice, and he referred to me because he just had like 5 conflicts in 1 week, and this was just too much to him, and he didn't know what to do about all of this. So he referred to me, and when I asked him when this started, he told me that this started on his birthday. So I asked him when was his birthday, and he was like, "This is confidential." I was like, "Okay, then tell me please at which point, like what actually got you upset on that birthday." And he was like, "I cannot tell you this; it's a secret." And he was very, very secretive about everything. He even didn't believe me and my friends that I'm a psychiatrist, and he thought that I'm some pedophile from California, like literally. And I had to send him my picture in order for him to see that I'm nothing to be feared of, to be scared of. And only when I started thinking like a paranoid person, I told him that, I understand that you started those conflicts not because you are a nasty person or you are a bad person, but because you want to be treated fairly and other people as well. Then he started to open up. So I needed to adjust myself to his values in his life. Okay. So schizoid disorder also usually debuts in teens with anger, emotional seclusion and coldness, inability to express sincere feelings towards others, and anger because their emotional expression is very diminished. They have weak reaction both on praise and critics, and this is very important. The libido is also weakened. They have high interest in introspection and fantasies, prefer solitary activity, and for them teamwork is hell. Like literally hell, they will never do anything in a team. They lack social normativity and have no close friends and no desire to have some, which is also very important to remember. Okay, we have talked about borderline disorder. Also hysterical disorder. So people with demonstrative personality disorder usually are prone to egocentrism, demonstrativeness, expressiveness of their emotions, high libido, are prone to fantasizing, have shallow thinking, they have a need in being praised, are prone to dissociative phenomena, and have very low frustration tolerance. And the difference from the narcissistic personality disorder is that narcissists are usually emotionally cold, and they are bound on devaluating people around them in order to feel valuable themselves. So that's a difference. The person with dependent disorder has active or passive redirecting responsibility. They're extremely conforming with their surroundings. They have no desire to demand anything from people they depend on, and they feel uneasy and helpless when they're alone all the time, to the point that they cannot do the simplest tasks. They have a fear of being left alone, restricted ability to decide things without encouragement from others, also ideas of own helplessness and incompetence, and they will do even unpleasant and dangerous tasks in order to stay loved. So that's also very important. They feel emptiness after the loss of contact with someone, and high sensitivity to critics. In case of antisocial disorder, it is the classical case of a psychopath when people think of one. So these problems usually arise more often in men, and there is prominent position of unresponsibility and desire towards and despise towards social cues, rules and duties. They are not very compassionate towards others, even may seem heartless. They have low frustration tolerance, are very impulsive. They have problems with planning ahead, and that's why a lot of these people end up in jails. They have low anger triggering and will go in violence. Once again, that's why they end in jails. They are very good at suppressing their guilt for a very long time, and they have a tendency to blame others. There was a story of a boy with antisocial behavior who killed his younger brother because his younger brother broke his toy. That was the sole reason for what he has done. Okay, there is also an ancastic or obsessive compulsive disorder. So the tendency to adaptiveness and carefulness is very characteristic for them. They are very perfectionistics, and because of their adapts, they avoid actually taking decisions. They are very pedantic and formal. They have an inadequate anxiety of the productivity, and this differs from the neurosis and from the just accentuation, because the person with psychopathy will spread these rules onto other people. And also they may insist on others. Yes, I have talked about this. They are prone to compulsions and obsessions. And once again, I'm not sure if I have told you these traits. So those are scales we use to rate psychopathy, include disinhibition, so how impulsive is the person, dissociation, whether it is psychic or motor or stuff, so how the person dissociates from their own personality, dysphoria, So all these people, to a certain extent, have a range of negative emotions explored. And uncasted, so how much the person needs to be in control of everything, of what is happening with them and with other people. So obviously, uncasted personality disorder people are very uncasted, need to be in control of everything. There is also anxious personality disorder, so they are very hypersensitive to food being refused, so they have sensitivity, high sensitivity. They're in constant tension and bad feels of unclear danger. Also, high anxiety over critics and ideas of own social disability and lower worth, but to the less extent than dependent personality disorder. They usually refuse to communicate without guaranteeing that people would like them. They restrict themselves in life in order to be safe. This is another sign of a disorder. The person restricts themselves without trying to solve the problems. Also, avoiding the social or professional activity or feeling critic. Have no close friends except relatives. They have a lot of social fears. I'm sorry. I'm just looking at my head. No, everything is fine. And they overestimate the problems and risks in simple and safe activities. So when we're talking about enduring personality changes which are not attributable to brain damage and disease, there was no previous personality disorder in the person, and after the exposure of catastrophic and excessive prolonged stress or following severe psychiatric illness, there were these changes, and this should be made, this diagnosis should be made only when there is definite and enduring change in the person's pattern of perceiving, relating to or thinking about the environment and himself or herself. And the personality change should be significant and be associated with inflexible moderate behavior, not present before. I would say that hospitalism sometimes falls under this category when the person just regards themselves as handicapped without any objective reason for this, when they are unable to live outside the hospitals and they just want to get there. Also, the change should not be a direct manifestation of another mental disorder or a residual symptom of any antecedent mental disorder. So people with Munchausen syndrome who want to get certain illness and have a delusional idea about having a certain illness, this is not okay. It was frozen once again. So enduring personality change after catastrophic experience should be present for at least 2 years. So once again, 2 years are given in order to determine whether this is a personality change. It follows the exposure for catastrophic stress, and this stress should be so extreme that there is no personal vulnerability against it. For example, there was an avalanche, so avalanche, everyone would be scared of avalanche or something like this. And hostile or distrustful attitude was develops. Social withdrawal, feelings of emptiness and hopelessness, chronic feeling of being on edge. So as you become, and PTSD change. And there is also historical with our medications. We may use anxiolytics or neuroleptics or antidepressants by the demand. Also, another thing I needed to tell you is that people with borderline personality disorder, just like people with schizotypal personality disorder, are prone to develop transient psychosis. This happens most notably in the form of hallucinations. But this is transient, so luckily it won't last for a very long time. Okay, I'm already dead from tiredness, so see you another day.